So injecting the platysma, we have to actually keep in mind that platysma is a subcutaneous muscle which is separated from the skin by the thickness or by the diameter of the fat, subcutaneous fat, and that may vary from individual to individual. So it's very important that we get to the layer of the muscle with enough depth to be able to penetrate the muscle and not place the toxin either beyond the muscle or before we get to the muscle. Now go ahead and tighten your neck for me, please. So you can see that we have 1, 2, 3. Tighten again for me. There are 4 bands coming into view. All the platysma, as we know, is extend and has attachments to the SMAS here and goes all the way to the clavicle, has only attachments down here. Now we can, it's important that we spread the injections throughout. We don't want to rely on diffusion or perhaps spread to get to the neuromuscular junction. We want to put as many insertion points as we possibly can. Now go ahead and tighten it again. So really what we're looking at is some of the points, again, right about here. Now these don't have to necessarily be injection points, but just gives us an idea, one more time please, of where the bands are located. But then again, platysma is in this region, but these are where we actually form the bands. So by relaxing the bands, sometimes we actually get some elevation. I'll go ahead and tighten again. You can see that there's almost a connection to the depressor angularis in a way or so. Now relax again. And then over time, it continues to pull the lateral or the jowl aspect of the face down just from the platysma. By injecting that area, actually get some improvement in the jowling as well. Important thing is that we don't penetrate too deep and get close to the other vasculature or muscles that may communicate to the muscles of the vocal cord or the esophagus and cause issues for us. So having said that, go ahead and tighten again. My preference is that to actually go ahead and pinch, and then do with each injection, I'd like to inject about a little over 1 unit of equivalence to 1 unit of Botox. So this is actually what I'm using right now is Botox, but obviously any one of the neurotoxins can be used. Go ahead and one more time, please. Thank you. Just want to get in just a little right here. Again, my depth is definitely through the skin and hopefully all the way down to the muscle through the fatty tissue, but I don't want to go beyond. Go ahead and tighten your muscle again when I grab. Once again, in a way I transverse the skin and stay horizontal, at a horizontal plane over the platysma. Each one of these syringes has about 12 units of Botox. Once again, tighten your neck, relax, let it go. By grabbing the platysma, it allows me to separate that from the deeper tissue which I do not want to penetrate. One more time, tighten again, relax, let it go. If I were to use this board, I like to use the 1:3 ratio of Botox or Xeomin to this board. Now, Jeuveau also comes equivalent units as to Botox. Now go ahead and relax and now tighten your muscle one more time. Thank you. So we can see this a little bit more lateral. And make sure we get through the fatty tissue here into the muscle. Okay, now relax again, tighten again. You can actually feel, once you lose the muscle, you can feel the muscle rolling away from under the skin. Obviously, this relationship between the skin and the platysma is more appreciated when we are elevating the skin of the neck in a lower face neck lift procedure. Thank you. So it usually takes about 2 weeks for full effect. In this region, it's very simple to inject using the proper technique of elevating the bands with 2 fingers, etc. Thank you. So I think it is important, go ahead and tighten your neck to be able to lift, hold on to the edges of the platysmal bands, and you can actually feel that rolling underneath, separate it so that you don't go too deep towards the esophagus and towards the thyrocricoid region, and injecting that in somewhat as soon as you go through the skin to stay horizontal. What is also important to note that sometimes with the neck it takes a little longer for the toxin to take effect. So I usually tell the patients to give it about 2 weeks to see the final results.